Hi, welcome everybody. What we'll just do is leave a minute or two to see if we have any other people joining. So what this is going to be is some thoughts and observations from myself, Amy to chip in as she wants, and then the opportunity to ask any questions and have a discussion about it. So this is, I think, something that we encourage anybody who is thinking about this to join, whether it's this round or a future round. I think it's very useful for us to know who's around there, who's interested in applying through Newcastle, and also I think it's useful for people to get a sort of sense of what this is all about and all the positioning that goes with it, which is very important. So should we go to full screen? I'm going to be lazy and have Amy change the slides. It's actually largely because I'm inept, and so it's a much better way of getting it to work. So this is about what my take is on the research professorship scheme, and also a little bit about the Newcastle internal selection process and the things that you need to think about. And I'll talk a little bit about the history of the scheme, because I think that's actually quite important for understanding where it's coming from. And we have James Wason, who's very kindly joined us, who is our current NIHR Research Professorship, who can give his sort of thoughts on the process and the scheme, if that's useful. Okay, so next slide. So this is a very personal view of where we are with the current round, or the round that's coming up is round 16. One of the things you have to realise is that the process itself is very slow. So they've only just announced relatively recently the people who were successful in round 14. The round 15 applications have just gone in, and now we're thinking about the process for round 16. So just be aware of that. It does take a little bit of time. The reason why I'm kind of qualified to give a personal view is that I was involved with NIHR training from capacity building from the very beginning, and so have watched this develop over the years, from its origins to how it is now. And I was the Dean for the NHR Academy for a number of years, people who don't know, and was responsible for overseeing it. And there were some important changes that came with all of that. One of which is that it actually then, during that time, moved into the NIHR Academy. And that's really important, because how this was in the very early days is not how it is now, because it underwent this fundamental change. And that was to do with the old days. Training in NIHR was run through the Trainees Coordinating Centre, and people felt very rightly that research professors were not really trainees. But when we moved to the academy, which is an academic community as a structure, it made a lot more sense. And clearly, a very substantial and prestigious personal award like this, it's appropriate it's run through the academy. So that is one of the differences. So the second point I think is really important, is that almost without exception, this is the scheme that evolves most from year to year. So although we can talk about the current competition where people have just gone in, clearly we can't assume that when the rules come out for round 16, they are the same. So please, 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 please do your thinking now in general terms, but look carefully at the guidance when it comes out to see if there are any important differences. So don't assume it will be the same. It's evolved in order to kind of shape the scheme. So it's not by and large picked up silly rules. What it's done is essentially address kind of issues that arose. So it's been quite a live evolution. I think that's strengthened the scheme. It is the peak personal award in NIHR. So obviously people are very aware of all the NIHR infrastructure. You've got BRCs and ARCs and so on and so forth. You've got BRC NIHR grants, but then you've got NIHR personal awards run through the fellowship, and this is the very peak of this. And actually, with some of the changes with Welcome and MRC, it's one of the very last high-level personal awards that's out there. So this makes it very important to NIHR, and it makes it very prestigious indeed. And these are absolutely, utterly career-defining awards. And so I think it's something for people in the relevant areas to really think about it. This is as prestigious as it gets, and it's the absolute peak in NIHR thinking. So the third point, it's not a conventional grant, if you like. It's more a high-level career booster. And the expectation is that this will provide the centre for other activities. So in a way, you are the product of this as much as the research. That's true of all personal awards, but it's really true of this. Okay, so it is about you and your future in the field and the extent to which investment in you will make a really big difference. And that leads on to the last point, which is what NIHR sees the RPs as being. And it sees them as being the academic leaders in their field. And I think a really good example of this came during COVID, where you may well recall two very high-profile people who were involved in the complex trials in ITU patients, where the platform trials that identified therapies. These were Tony Gordon and Rupert Pearce, both intensive care consultants, and both of them were NIHR research professors. They influenced national policy, and they went to them because they were seen as the go-to people in their field because they were NIHR RPs. Now, don't find that as daunting. People are delightfully modest about their own contribution, and the award actually helps you to become that as well. But that's what NIHR wants. These are a college of absolute experts that NIHR can call on if it wants to do that. And as James will sort of testify, that sort of made manifest by invitations to join panels and to guide and to be aware of contributing to shaping it all. So these aren't grants to fund some research. These are, they certainly do that, but they are also about establishing your position as a leader in the field so that NIHR knows who its experts and who its people are. You can see, therefore, why this is very important. This move to being the go-to people was very much a Chris Whitty thing. Okay, so Sally Davis, when she set up NIHR, these were more like high prestige fellowships. With Chris Whitty, he moved to this college of experts model, and that I think is now very hardwired within the system. Lucy Chappell, who is Chris's successor as head of NIHR, she's a former research professor. Waljit Diller, who is my successor as the dean of the NHR Academy, is a former NIHR research fellow, research professor. So you can see that the thinking around this will, if anything, have been strengthened. So just be aware of this. And as you're thinking about developing your career, maybe if you want to go for this in a year or two's time, how can I be visible as the person in this area? So a bit of guidance I always give to people about career development is focus what you do. Have your big project about how you become the identifiable person you want to be, and anything that you're invited to do that strengthens that narrative, do it. If you are being pulled off into other areas which kind of dilutes the message, just be a bit more cautious about it. So it's really important to see it's about the leader. Now, a useful thing you can do is, NIHR is very transparent. All previous research professors, their details are on the web. And so actually, it's quite a good idea to have a look at that and go through current award holders and previous award holders and find out if you're the only person in that area. It's actually a very useful thing to know about, because if you're the first person in a particular area, that would absolutely play to this concept of really important. The other thing that's important, you'll see when we list the people who've got them in the last reported round, clearly the challenges and needs in the health and care sector are evolving all of the time. And so just be live to the relevance of what you do now and in the future. So, when I first started with all of this, public health wasn't so prominent. Now it's very prominent for reasons that are entirely obvious for anybody who listens to the news. So fit to the scheme and working on that. Now, Amy and I will advise people very much on how to do that positioning, but this is a bit that needs a little bit of time, if you like. Okay, next slide. Oh, go on, Amy. Humour me and show me the next slide.
Tried. It's not going. Oh, there we are.
Right. So the mechanics of it, and the caveat is this is for round 15 because we haven't got the rules for round 16 yet. So these are things I suspect which will be unchanged, but you know, seem to be aware of it. Okay. So the first is that these come from HEIs. They essentially come from universities. And the rule for the last few competitions is that HEIs can nominate up to 3 people for the main scheme. We will talk about a second scheme about global health a little bit later on. But for the main scheme, you have to be nominated by the organisation. So this actually is an advantage to an organisation like ours, because if it was an open application, it would be flooded by people from much larger organisations. So HEIs can nominate up to 3 people. The rules are that 2, 1 or both of these has to be a woman, and there is an additional slot from an ethnic minority. Now, this is about ensuring that people get a fair crack of a whip, not at the level of NIHR, but at the level of their universities. So this happened in 2 steps. The first was the introduction that you could only put 2 people in it if at least one of them was a woman, is because 80 to 90% of submissions were nominations were coming from men, and this was felt to be unfair, and this absolutely changed that. It changed it to 50-50 actually, and the awards were always 50-50 of the applicants. So I think that's been a really good example of nudging into nudging into sort of behaviour patterns by organisations. I would add that in round 15, both of our applicants were women. Okay, so I think it has had a very substantial effect. An additional application from an ethnic minority is a more recent change, and I think is a little bit more complex. So that's yet to play out in terms of its impact. So we can nominate up to 3 people along those lines. Okay. Now, particular calls for applications will come in certain areas. And last time around, this may be the thing that will change, is public health and social care. Anyone who reads the news can see why that's important. And from nurses, midwives, and allied health professionals. This is a major area of importance to NIHR, but as you will see, the last round were all medics, and I'm not sure that's necessarily helpful. What does particular call for applications mean? It's probably benefit of the doubt and no more than that. So there is no bumping up of scoring. It's just that if there are 2 equal people, now that might be down to the chair and how the chair guides the panel. So, you know, clearly we're very keen to see applications from all of those areas, as NIHR are. They may have worked on what that actually means in practice, but at the moment it doesn't mean necessarily a huge amount. So nurses, midwives, AHPs, health and care professionals, these are different interchangeable terms, do have a difference in the rules. Now, the rules for medics and for methodologists are that you can apply within 5 years of your most recent promotion. So that's senior lecturer to reader, senior lecturer to professor, reader to professor. It must be within the last 5 years. So there is a time limit for that. Now, in practice, as you'll see in the awards for this year, the majority of awards are made to people who are professors already. So probably the sweet spot is 2 to 3 years as a professor in your host organisation. That's not a rule, but it's an observation of the way the panel is tending to think. So you can do it earlier than that. Put a marker down, but just be aware that probably 2 to 3 years. Be careful of 5 years as a professor. People are starting to say, do you really need to have ring-fenced funding? Shouldn't you be able to compete in, you know, open competition? So those things. That rule does not apply to health and care professionals, nurses, midwives, AHPs, because of the slightly different career structure. So remember that, that's important. Requires significant co-investment from the host, which must be delivered in practice. Now, one of my roles as NIHR Dean was to enforce delivery in practice. So you can imagine the enthusiasm I grasped that with, because there is a long history of organisations making promises they don't then honour. And NIHR got sick to the back teeth of that, to be frank. People be promised the sun, the moon and the stars, and that was then not delivered in practice. I was sent an email from a very prestigious university applicant that she had sent to her head of organisation to say, what is the matching commitment from the university? And he had written, you can put in whatever you want, we're not going to give it to you. And that ended up on my desk. You can imagine how well that went. So there's an honesty about this now. They don't want to see a Dutch auction of how many PhD students, how many this, how many that, how many the other. They want to know what you're actually going to get, and then they will check that you actually get it. Okay, so this is really important. Be aware that it needs to be a bit smarter than just some PhD student. You know, they're all a bit cynical. We're all a bit cynical about, you know, I'll have 2 PhDs or 4 PhDs or 6 PhDs. This is about investment in the sorts of posts that you need to be a success in your area, which will, of course, differ from person to person, absolutely. So this needs to be thought through. At the very least, your salary needs to be recycled into support posts. But that's the starting point. That's an expectation, an assumption. It needs to, in fact, be more than that. And we can guide on that. This is about co-investment. This isn't about giving you more resources to do research. This is about the NIHR investing in somebody they think is important. And we would assume if NIHR thinks somebody is important, their university would also think they're important. So this is about joint investment in people's futures. It's really important. Next one. Oh dear. Right. So what makes a compelling RP bid? This is so much more than a really good project with some costings and a CV attached to it. For all the reasons that I've said, this is more than that. It's about creation of a function, something that matters. So, positioning that fits with NIHR remit and vision now and what might be expected to happen in the future. Historically, when this first came along, there were a lot of people in what you might call translational research, taking basic science and turning it into drugs and things like that. They've rather moved away from that, not exclusively, into applied health research. And the 3 RPs that we've had over the history of the scheme have all been in more applied health research. That does not mean that people working in traditional translational research aren't looked at. It means that there is a panel that has more of an applied health research focus. Okay, so you just need to be aware of that and how you write it to make sure that the panel will get it. Ownership of the space, I think, is really important. Are you a name in the field? Are you somebody people elsewhere will think about? You know, are you going to become, therefore, the person in it? So this sense of creating that identity around you and what you do and research in the sort of space area. Emerging priority area or an underserved group is very helpful, very important. Now, an emerging priority area may be an area that has just become really important in the last 5 years, right? Or an underserved group may be an area that's always been important, but they've always struggled to have leadership in it. And you could argue in those areas that the leadership that comes from an RP is actually really important. So particularly nurses, midwives, allied health professionals, having real visible professional leaders in that space will be very powerful moving forwards. That message hasn't necessarily got through to the panels and maybe not through to the applicants, but you can see the value of all of that. Really, 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 really important is to be seen to be a member of the NIHR family, okay? And James will testify to me banging on about this endlessly as he was developing his application. This NIHR sees itself as a family, the Academy sees itself as a family, so be involved in it. So be involved in BRC training or ARC training, or put your name forward for panels. If you're invited to go and sit on advisory groups, do that. So that visibility, being a good NIHR citizen is really important, okay? And we are very active in putting our people forward for sitting on panels and things like that. For those of you who don't know, the Academy panels, you have to put an expression of interest in. There's an online form to do that. It's just your professional background, demographics and things, and they have a pool of people who are interested in doing it. They won't ask you to join a panel immediately because they have balance around professions and geography and demographics and so on, but they will ask you at some point. So anybody who's interested in RP, put your name forward, sit on NIHR panel, and you will be invited. You will learn more about how grants get funded in one panel than you have learned to date. So do that. It's really, really helpful. And then they want to see the fact that there's an old saying that don't make the first, the last round. So have your last round of peer review being internal. Okay, so don't ask panels to finally develop your application for you. So having an internal process that quality assures the people going in is very reassuring, because it won't look like you're asking the panel to do all of the work. So we do have a very robust process. We do it over a length of time. We've really brought forward the various different stages of it to allow people time to be able to do it. But NIHR know that we do that, so they know the applications are high quality, and that's really helpful to everybody. And then, as I said, the support that is offered has to be realistic, and it has to be with a history of delivery, both for this and for other NIHR programs. And there's a sort of rightness, if you like, to an RP bid. This is obviously in addition to the science that you want to do. So this is about a good fit to the scheme. Next one. So this is the offer that they make. This, of course, may change. You will have all noticed that we are in a strange time in terms of finance, in terms of spending reviews and things like that. So we just need to be aware of that. So this is what happened last time. It may change. I suspect it won't. This is in addition to what your university will provide. Okay, remember your starting point is your salary recycled, but that's just the starting point. Each award will consist of a package to support, and these are examples of the sorts of things. It will differ from thing to thing. 1 doctoral, 2 postdoctoral appointments, research running costs, travel fund, leadership development program, sabbatical support, indirect costs, and they are 5-year appointments. So the NIHR pays 1.7 to 1.8 million, something of that order, and then they would expect the university contribution to take that well over 2 million. But you do not have to stick slavishly to this. You have to put in what was necessary for your type of science and for your particular personal situation, and it will differ hugely. So the two that went in this year, actually very different support packages, because that fitted with what they wanted to do. Okay, next one. The ask, this is not me, this is what NIHR say. By the end of the 5 years of the award, NIHR research professors will be expected to have established at least 2 major international collaborations, demonstrated leadership at a national level, have been developed and protected by the institutions, including been relieved of administrative tasks at the local and regional level, so that they concentrate on their professorship. So I don't think any of those things are unreasonable. We in the NHRP Academy are very proactive at providing the kind of third of these, which is to make sure that people have the space-time opportunity to be successful with it. But I don't think these are in any way unreasonable. They're aspirations. Nominating organisations must demonstrate in specific detail the commitment to the ongoing employment of the nominee beyond the duration of the award. In my time as the NIHR Dean, I had to deal with somebody who actually was going to be sacked by their university at the end of an NIHR Research Professorship, because although they'd met the standard for the NIHR, they hadn't met the standard for the august university down south, and that's completely unacceptable. The NHR is not investing in people to have them made redundant by universities. So there is an absolute expectation there is ongoing employment of the nominee beyond the duration of the award. That is not an issue that anyone here needs to be aware of. People here are very familiar with our support structures for people, but it is in black and white. Okay, so and it was done for a reason. Okay. And the last one is the point about freeing existing resource to increase the capacity. Okay, we can help with all of this. These are not particularly issues that we encounter in our organisation. All right, next one. These are the ones who were appointed in round 14. As you can see, there were 2 There were 2 non-professors, 5 professors. I don't know Laura Coates. I do know Noreen Starling. I think the fact that she wasn't a professor reflects the issues in the organisation around promotion rather than anything else. So she's actually at a very high level. So you can see the areas. They are of a sort of there's a particular type of project here. So what I would suggest you do is go and look back at these and previous award holders to see, is there somebody already funded by one of these in exactly your area, in which case you might want to flex your area a little bit. This is an independent competition. This won't particularly guide the panel, but it might be the sort of thing that's raised at the panel that actually this is very similar to one that we've already got one in. Now, it's very important it's nuanced within all of that. So one of our, I'm not giving any state secrets, one of our applicants was in the field of cardiology this time around, and that there is a just recent RP in cardiology, but one was in intervention studies, one was in imaging. Okay, so they're actually completely different elements and they're complementary, not in competition with each other. So just be smart about where you sit in your particular area. Next one. The Global Health Research Professors was introduced in my time. This is a Chris Whittyism because of his enthusiasm for global health. It's a separate scheme, but in terms of the hard points, similar ask and offer. So it supports researchers in low middle income countries and the UK working in applied global health research. They have to meet the eligibility criteria for official development assistance. This is the government definition, so it has to come within that. You can read the rest of it. The thing that's really important about this is that everybody assumes that global health is infectious disease. Actually, the awards they make are largely in the rapidly developing chronic disease issues that are affecting developing countries. Okay, so where incomes are increasing rapidly, so some of the chronic health problems of more affluent countries are coming to bear, where necessarily, it might not necessarily be the healthcare structure. So they funded them in stroke, they funded them in anaesthetics in the last couple of rounds, how you deliver anaesthetics in these settings. So do not count this out because you don't work in infectious disease. In fact, the reason for that is that most of the infectious disease research in the global health setting is funded by Gates and by Wellcome Trust. So it was felt in NIHR that simply to add further funding in that space was to miss these other important challenges. So there are some real opportunities. You do need to have an infrastructure in a low or middle income country. So just hopefully wanting to extend your research into those settings without the infrastructure to do it is not going to fly. Okay, and you can find the round 8 awardees, but they make the point that these are not in infectious disease. Next one. So our selection process, we want to keep it nice and simple. So a short CV, okay. Top 10 papers with information on citations and impact. Why does it matter? Why is it important? Grants, and then your role in capacity building. And then essentially a short document, which is about your vision, how it fits to the scheme and your role then actually to it. Take what I've said and essentially put down on paper why you fit into that. And this is an iterative process, but we want to give people plenty of time to develop applications. So got a month or so to pull that together. Less is more with the vision, okay? It really is your vision that we want to see. So we're not asking for a detailed application. That will come down the line. This is about absolutely your concept of where this would all go. And if you've got any questions, ask Amy or myself about it. This is about a fair and transparent process, and it's about giving people enough time to develop the full applications. We are keen to know people who are interested in this, but not this year. Okay, that's also very important. And I know a number of people on this call are thinking about future years. That's excellent. It gives us an idea of who's coming through. So this is useful for everybody. the art is to choose the right point. But as I said, probably 1 to 2 years following promotion to professor is kind of the top of the bell curve of distribution. Next one. That's it. So Amy, do you want to add anything about the process side of it, what you want and need? Because obviously you and then I and then other colleagues will be very heavily involved in supporting the application development, but in a sense the sort of preliminary stage is more in your court. Is there anything else you wanted to add?
No, we're very happy to speak to people ahead of the internal selection deadline. So if you want to come and have a chat, we're very, very happy to do that. I know some people have already booked that in. I think James would be very happy to speak to people as well. He's usually very helpful with these applications too. Just follow what we've said. We don't want a massive internal document, so please just follow what we've asked for and feel free to apply to the internal selection with a view to a later round as well. Very happy to give feedback at this stage and have a pipeline for future years. So just get in touch, please.
Lovely. James, I mean, do you want to add anything to what I've said? You're actually much closer to all of this than I am now. Is there anything that you would add?
Yeah, I could talk for a few minutes if that's okay.
Yeah, lovely.
Okay, great. Yeah, so for those who don't know me, hello, I'm James Wason. I'm a professor of biostatistics and I'm now in my 4th year of the research professorship, so it's gone very quickly. I was nominated back in 2020, but that was the 3rd time I had put myself forward for nomination, and in retrospect, the extra couple of years did give me a lot of opportunity to develop my collaborations and to do patient and public involvement and things like that, which led to a much stronger application. So I would echo what Dave said about planning these things ahead in time, not just thinking it has to be this year. So just a few things I would say, and some of them very much overlap with what Dave has already said, but I'll say them again to emphasize them. So first thing, I would treat this not as 3 project grants that you stick together. I would try to make it more of a vision / story of how it will make you the future research leader that the NIHR wants you to be. And they do want obviously some work is going to be funded in it with the free posts and the support posts that the recycling would enable, but they are very willing that it would take more than that to achieve that vision. So having separate funding for some of the research is expected. So that was one piece of advice I was given. Don't just stick 3 nice project grants together, because that's not going to make for a good application. If you do get picked this year, you'll hopefully have 6 months for the putting together the application, and I would really advise you to block off a good amount of time throughout that 6 months to work on it. Don't leave it until the last couple of months, because it does need a lot of polishing, and sending it to lots of people for comments and incorporating their comments is really something I would recommend. I sent it to many people to get comments, including Dave, and it was invaluable to do that, but then it needs time to get to that point. Do think about how to use the additional resources that the university is meant to provide through the salary recycling. I got basically a more junior academic posts promised, which would mean that some of my teaching and administrative duties would be taken care of. I also got some funding for an extra research position, a data scientist position. There was a PhD studentship and some miscellaneous extra non-staff costs, like contributing to the leadership development costs, for example. So hopefully that's something you can think about, how you could best use that to make your research plan and your vision achievable. Would definitely echo the being part of the NIHR family. So at the time I applied, I was on the NIHR Health Technology Assessment panel, and I was quite surprised when the number of research professors that were on that panel. There was something like 3 or 4 people on the panel were research professors. And every meeting of research professors, Lucy Chappell opens up by asking people to raise their hands if they're on an HTA panel. Most people raise their hands. The people who don't raise their hands, she says, you need to join an HTA, need to join an NIHR panel. I think it's a good thing to do in advance of applying. I was also taking part in capacity building in statistics and other methodological areas through the NIHR incubator. So hopefully there's something similar that you might be able to do in your area. And finally, I think one area that's a bit maybe neglected in applications, but it's worth quite a proportion of the marks, is the leadership development programme. I think it's worth spending some extra time to make it more specific rather than, it's quite easy to make it generic, and that doesn't tend to score very well. So one thing I thought through was, what would I see myself doing at the end of 5 years? And what were the barriers to me doing that in terms of my leadership skills? And then I chose training and mentors. You can have up to 4 mentors that would help me address those gaps. And I think that part of the application was rated very well. And I would recommend it's worth the time to do that. I think that's all of the advice I'd written down, but happy to say more if anyone's got any questions.
Thank you, James. I think the point about leadership is very important. So this has the leaders of the future written all over it in terms of the aspiration. And obviously NIHR runs its own more generic leadership training. However, it goes a little bit beyond that for the reasons that James says. It's about you, your area, and also your strengths and weaknesses. We all have strengths and weaknesses, and really good leadership training is about understanding what you're good at and building on it, but most of all, understanding what you're less good at and mitigating that. So a combination of the NIHR stuff, but also what you need. And one of the things that we do in the Academy here for people coming up to these sorts of things is offer coaching around these aspects. So help you get some insights into your strengths and weaknesses. Most people are pretty good at knowing what their strengths and weaknesses are. Most people exaggerate their weaknesses and understate their strengths. So they're actually better than they sometimes allow themselves to be. But just sometimes you come across people who are kind of the other way around, and I think it's quite helpful. So what are the things in life you like to avoid and you like to do, and how we can build on that? Right, good. Questions. So anything to any of us about the process or about any aspect? Amy?
Not necessarily about the process, but just to get your thoughts on, in the current financial climate, whether that is likely to influence the kind of the scale of support that Newcastle would offer, or whether that is something they've already kind of addressed. And
Okay, so you've got 2 aspects to the financial climate. There is the national one, which is completely and utterly beyond our control. So obviously NIHR is going through the spending review like everybody else is. I was around for the last one. We did very well out of that. So there is the potential for schemes, funding, etc., to change. For what it's worth, I don't think this will. It might reduce the number of awards. I think if anything is targeted, it's more likely to be infrastructure rather than personal awards. So we just need to, there's nothing we can do about that. To the organisation, I think we have discussions about this, as you might imagine we do. And I think there are a couple of things to say about this. The first is, what is happening in the university is a short-term thing. And actually, we're talking about people who aren't going to start until, next year. So this is in the future rather than in the now. Okay, so the issue is over the next 12 months, these posts start beyond 12 months. That's the first thing to say. The second is fundamentally, and this is the discussions that we have had at great length, is that you guys are the future of the organisation. So Newcastle, I was with Dave Byrne this morning, and we were making the point that neither of us will be here in 10 years' time, but the organisation still will be. And it needs to have the brightest and the best people leading it. And that is understood, absolutely. So future development of the best people is clearly a priority for the organisation and will be ring-fenced within all of this. Okay. Clearly, also, these are awards that bring in a substantial amount of money. And I'm not an economist, but if we haven't got enough money, bringing more money in is a good thing. Okay, so these are a means to an end. So for all of those reasons, it's absolutely under close review. Okay, close review, and we keep them honest about it all. But the discussions that we have, they absolutely understand the importance of your generation of researchers and the sort of generation below, because when I've long since gone and Dave Burns long since gone, you'll be running the organisation. If we don't have that group of people coming through, then we're in real trouble. So I wouldn't be worried about it at all, and that applies across the piece for career development posts. So this, I think, is one of the advantages of the NHRP Academy coming along, to have this slightly autonomous structure. It does allow us to be slightly separate from the kind of difficult decisions they make in faculty, because we're making, principled points about the future. So I wouldn't be worried. I would absolutely not pull your punches in terms of what you need to put into an application because of that. That would be completely the wrong thing to do. So I think you press on. And the key thing for recycling the money is what would help you in your area of research in terms of people. So you heard James says, for him, those were the things that were helpful to him. It will be different to everybody. And you let us worry about the negotiations with the faculty.
Thank you.
Will.
Thanks. So it's another follow-on relating to financial climate and things. If someone's in the position, purely hypothetically, no relevance to myself at all, obviously, where they don't have any ongoing contract or existing commitment of support from the university, can they still apply, and how would it work? Would NIHR take the view, well, the university has to redirect the nothing that they're currently committed to giving you, so it's a freebie? Or is there a first thing that the university would have to already have committed substantial investment to the individual, and then you can only apply if and when that's done, and then it would be on top of that?
Yeah, so I owe you an email which follows on from discussions that I've been having. Okay, so the answer to that is to regularise the position in advance of that. So that's what we need to do. It hasn't been 100%. It will be 100% shortly. So basically, the answer to that, you're right, is that you need to underpin people and then put them in a position where they put the applications in. And that this is what we did with the NHRP Academy. It isn't 100%, as you know. It will be 100% shortly. I will send you an email. So I think in general, you would want to avoid the imagery. You'd want to avoid the imagery of asking the NIHR for an enormous amount of money for somebody that you in the organisation are not prepared to invest in. And so I think we wouldn't want to be in that position, but you do it the other way around, which is to regularise all of that. We didn't really talk about science, and I do think you have to be, we all have to be slightly careful as to NIHR remits, but also the sensitivities around remits. Okay, so NIHR covers really everything from experimental medicine all the way across to sort of policy research and implementation science. However, the panels don't really reflect that, and so it is possible to get NIHR advanced fellowships and RPs in translational research, but you have to be very careful how you write them. And the sort of thing you might put into another funder, isn't going to fly with NIHR. So there are some examples, largely because people following on from the BLC investment in all of this space. So everybody's different. NIHR has a bit of an obsession about biomarkers, as people will be aware, for a variety of reasons. So I think if people are on the more basic end of the spectrum, then it needs an early discussion, not about the quality of the science, but about the fit to the scheme. And actually, we've got quite a lot of experience of that. And I've certainly seen and supported people to get advanced fellowships from really quite a basic science perspective. It's all about how you pitch it, okay? No pun intended for a sound scientist. It's all about the pitch. So those are, this is a general advice session. Clearly, everybody on this call will have different science and different strengths and weaknesses when it comes to NIHR, and that's when it becomes a little bit more bespoke. That we can deal with, by the way. We're smart. We are also smart in the sense that these don't always need to be resolved at the vision stage, okay? Because, you know, this can be worked through as you develop an application, but it's got to be so that we can see it will fit to NIHR. You know, it may not be that you've got the right collaborators for anybody. On the more basic end, you might not have the right collaborators now. We can guide with all of that, but will this be NIHR remittable, or will it be ruled out of remit? The last thing we want to do is to use one of our nominations for somebody who gets ruled out of remit, and we would never do that. So it is workable, but give us enough to work out what we might need to do with that. So if anybody who is slightly worried that they're more at the MRC end of this, then just kind of give us the vision and be honest about what the challenges and the needs are, and it's all workable with. Basically, just on that note, there are 3 NIHR questions, I mean, 4 NIHR questions that just think about. So NIHR asks itself, who benefits from the research? How do they benefit from the research? When do they benefit from the research? And how do you know they've benefited? Okay. So clearly, you need to not explicitly answer those questions, but make sure it's clear who the beneficiaries are. They could be individual patients, it could be the NHS, it could be society as a whole, but you need to have a clear sense of who the beneficiaries are. If there are no beneficiaries now or in the future, then it's probably too basic for this scheme. Amy, do you want to add anything about that?
I thought you might want to throw in the Truro question.
Okay, then we'll throw in the Truro question. And many of you will yawn at this because you've heard it all before. So there are 3 questions. There are the 4 standard NIHR questions. Then I've got my questions, which I kind of sort of developed and I think are useful to think about. So the first of them is the Truro question, not designed to be rude to anybody who lives in Cornwall. It's just that that's as far away as you can get in England from Newcastle. So if your research benefits people here, how does it benefit people in Truro? If it doesn't, then it actually makes inequality worse. So if you are improving the outcomes for people here, but not in Truro, that creates inequality. So that's how you disseminate, how you implement, how you reach out and connect. So, for example, if you were doing a complex intervention that benefits people, the Truro question is answered by a training package that allows that to be taken up, say, in a GP surgery by a specialist nurse or something. So it's how does it reach across the whole country? And don't just say writing papers, writing guidelines, because actually they're quite poor ways of getting change into practice. So that's the Truro question. The Easington question, a lot closer to Newcastle, not far away at all, but in socio-economic terms, it's a different planet. So how will the research benefit those people in low-income groups who do not have access to good healthcare, do not have access to good nutrition, often will have poor access to healthcare? Is this going to be something that the Worried Well in Gosforth will pick up, sorry, Amy, and not benefit people in Easington? Because, again, if that's the case, you are worsening inequality. So how do you reach out to those socioeconomically isolated groups? And then the final one is the Fenham question. That's really quite close to here. But when you look at some of the very sort of closed, say, Bangladeshi community where women can't access healthcare unless their husbands give permission, that's that whole additional level of access to all of this. So how do you make your research fair and relevant to everybody? And obviously, in certain disease areas, it's mandatory, to absolutely focus it. So, for example, type 2 diabetes in the South Asian population. So if you have interventions around type 2 diabetes, actually, if you don't over-engage the South Asian population, you're actually going to hamper your own research. So these are not official. They're just, how do you get it across the country? How do you reach socioeconomically deprived groups? How do you reach closed ethnic communities? That's not just the Bangladeshi community, the Jewish community in Gateshead would be another one. The Somali community in South Shields will be another one. They are difficult to access. There are many people on this call who know far more about this than me, and for whom this is a key part of what they do. But it's this trying to get away from the kind of PPIE element for your research being a taxi coming from Gosforth with lots of nice bien-pensant people. If they aren't the ones who are the users of the outcome of the research. I'm really sorry, Amy. She's very sick of me making the cheap Gosforth point. And then also in terms of isolation, don't forget rural, don't forget coastal. Okay. Now, one of the strengths of the Northeast is, I mean, ironically, is that we can access all of those populations. And you know, again, there are many people on this call who are far more familiar than me with all of this. So don't forget those other populations. It's not just post-industrial, post-mining places, it's coastal and rural as well. More questions? Silenced everybody. I hope you're not all determined. So Will, sorry, yeah.
A quick follow on one. Does NIHR, how much do they care? Obviously not for the specifically global health, but for international geographic reach, for an ordinary non-global health type of thing?
I mean, the Chris Whitty view of the world is you go and work with the best people to work with. Okay, so that would be seen to be a strength. His view, I mean, for those of you who've heard him talk, and he's still obviously hugely influential, is that more basic science is carried out in the best places, and you know, in a sense, can be national, international. So you do it where the best laboratories are. Applied health research has to be rooted in the populations that it impacts upon. So in terms of travel and going to centres, collaborative work and things, that's all seen as being very strong indeed. So that's a strength, not a weakness. Also remember the argument I call the UK PLC argument. So I can tell you now, because I've been there, spending reviews are dictated by Treasury. Treasury do not care about the intellectual value of your research. They do not care about benefits to patients. They do not care about people living longer. They don't care about anything. They only care about financial return on investment. And so there is a metric that all government departments have to come up with, which is the income that is generated by each pound that the Treasury spends. Okay. And it's a horrible process. I don't miss it at all. The point, though, is that what we all do collectively does have the potential to have a return on investment, be they improved health and productivity, be they industrial investment, be they any of those things. So thinking about how your work actually has a financial return, even that isn't the driver, think about, again, it's who are the beneficiaries of it, that there's a real strength with it. I mean, the other thing to all of this is, and you've got to be slightly careful about this, because by the time these applications are fully assessed, the world may have changed. But if we can see a kind of oncoming train, if you like, coming down the tracks, then doing work in those areas can have real value. Okay. Now, the danger is, I mean, people remember Zika virus, and somebody got, you know, in Newcastle got a very big grant for Zika virus in pregnancy, and by the time the grant was set up, Zika virus had disappeared. So you've got to be slightly careful following these things. COVID, to an extent, is very similar. But what really vexes government at the moment, remember, NIHR is part of a government department. It's not politically driven or directed, but it is politically smart. So it listens to and understands the political pressures and makes sure it is part of the solution. You know, it doesn't say we're not going to do that because we're independent. That would be a foolish thing for it to do. So what really vexes the Department of Health and Government at the moment, it's long-term ill health and inability to work. So what are the ways in which we could support people to go back into paid employment? Another one is about the public health to primary care to secondary care to tertiary flow of patients. How do we make sense of patients being treated in the right environment? How do we prevent long-term chronic illness? The whole public health, social care, public health, primary care nexus, and how the healthcare system works. Anyone who reads the newspapers knows that those are areas where we need new thinking. And therefore, those sorts of things, provided you've got the heft behind it, would be very attractive. You know, simple stuff. We're asked all the time, how do you stop people turning up to A&E in an ambulance? Now, the answer to that is that you get the system working better. You don't just divert the ambulances. So, but it's about anything in those areas. So there's an element of right time, right place, right person for all of that. And of course, that's where a a question that people will always ask is why Newcastle? You don't need to explicitly answer that, but you need to be implicit in your answer. And the answer is why Newcastle for many of these things is because we get, less money per head of the population from government than anywhere else in England other than Cornwall. And so therefore we are disadvantaged, and therefore these are the problems we as a community have to face. So if we might as well face those problems in the place where those problems are greatest. So that's not the only reason for Newcastle Research, but it is a powerful reason. And I can tell you the policymakers get that. Doesn't stretch as far as sending money up here. They send money, by the way, to Manchester because that's in the north as far as they're concerned. So it's job done. So that's why this is where the problems are. So this is where the solutions need to come from, is a powerful argument. This is all about selling the vision of what you're doing. Okay. Any other questions? If not, ping us a question if you've got specific ones about your particular things. Useful for us to know, kind of what's coming so we can manage it all. Give us a spread of the years that you might be interested in. So don't wait to the 5th year as a professor. I don't think that's good. So it's this year or next year. For many people, there will be a, and James commented about, the internal process before, but I think you had 20 papers, I think if I recall correctly, in the year in advance of the one that you actually went in. So we have peaks and troughs of our output. So there will often be a right time in terms of your momentum. So just have a little thought about that. So it's just useful for us to get the largest number of the strongest applicants we possibly can over a length of time, and don't leave it to the last year because that forces everyone into a corner. Good. If there are no more questions, we'll call it a day. And I think the recording's going to be online, isn't it, Amy?
Yeah, we'll share the recording, yeah.
Yeah. So, and if you've got specific questions, just ping them to us. Okay.
Thank you.
Cheers, everyone.
Thanks for your time.
Thank you. Bye.
Thank you. Bye.